Hello, Colin Hung here for Healthcare IT Today, and I'm coming to you from Arlington, Texas, where it is sunny and beautiful here, and I am here because it's the Greenway Health User Conference, called ReEngage. It's been a couple of years since Greenway held their user conference, and I was very excited when they invited us down to cover this year's event. I especially was looking forward to hearing what Pratap, their CEO, was going to talk about in terms of where their company is heading next. Now, before I dive in, I just want to say thank you to Greenway Health for inviting us to come down and cover the event. This video is not paid for by them, and they have had no editorial input into what I'm about to talk about. Pratap kicked off the user conference with a bang. He kicked off with some very bold statements in his opening keynote here around where he's going to take the company and some of the things that the company is working on. Right off the bat, he made this bold statement about how every innovation going forward coming from Greenway will be based on AI. And what he meant by that was both internally at the company, they're going to be using AI to enhance what they do and accelerate what they do, but also that the new features and functions that they're coming out with will all be around AI. And then he went on to talk about all these fantastic new features and functions, especially ambient clinical voice, powered by Nabla, that will be rolling out or have been rolled out to their clients. Now, Pratap also said that because of this, he's making a commitment to really accelerate the pace of change here at Greenway. They're going to be rolling out many more features that were both in terms of cybersecurity, in terms of workflow improvements, and in terms of user experience design. All of those things will be coming out in much more rapid fashion from Greenway. Another bold statement that he made was around how he intends to make Greenway the most respected EHR on the market, and how he is moving the company into a much more aggressive stance to win more market share from his competitors. While I was here, I had the chance to sit down with Pratap and with David Cohen, their Chief Technology Officer, to dive more deeply into some of these promises that were made and get the real inside scoop on what specifically they're going to be doing around AI and enhancing their application. And I can tell you that what I was most interested in was Pratap's statement to me that we are going to see more AI-powered tools from Greenway that are really focused on reducing the administrative burden while keeping the clinician fully in the pilot seat. Here's a quick snippet of some of that interview.
I view Greenway as a company that's going to be powered by AI, but driven by our core purpose and values. And our core purpose is around making sure that our providers are successful, making sure that their patients are empowered and engaged, and thereby leading to healthier communities. So now if I take that and I pivot back to what's happening with generative AI and how we are leveraging generative AI, firstly, Colin, I've been in this industry for a while, and people have been talking about AI for more than 2.5 decades right now. There have been things that have worked, but mostly there have been clients, vendors, partners have found it difficult to really apply AI in meaningful ways to their day-to-day lives. There's no doubt in my mind that this time is different. And what we've done at Greenway is we are actually using generative AI as a way to leapfrog not just ourselves, but to leapfrog our competitors in terms of how we integrate AI in everything that we do.
And here now is a snippet of my interview with David Cohen. We covered a lot of different topics, including how they're going to be consolidating their UI into single one. But I really enjoyed my conversation with him around interoperability, the current state of it, and what Greenway is doing about it.
I'm also, one of my side jobs on the board of the Commonwealth Health Alliance. So this is something that takes a lot of my thought and time, is not just thinking about Greenway's position around interoperability, but where we're going as an industry around interoperability. And we're obviously, I think, at an inflection point with TEFCA coming onto the scenes and Commonwealth, becoming a certified QHIN, but still a lot to be figured out around how national interoperability is going to work and how QHIN to QHIN interactions are really going to play out. But I'll tell you, from a Greenway perspective, I think we're very well positioned. That's one of the reasons we've been focused on building Greenway Data Cloud, is that we can have a pre-compiled FHIR data store so that we can be very responsive and interactive with our FHIR capabilities, both outbound and soon inbound FHIR capabilities, preparing for that bidirectionality. And we're working on shoring up those interoperability workflows as well within our EHR systems.
Now, I have to say that this conference has been fantastic. It's been a lot of engagement, a lot of interaction with our clients. And you can really see the folks that are here have really been keen to talk to Greenway about some of the new enhancements that are coming down the road, and about how they can roll out even more of that functionality that already exists in the product. Constantly, I've seen people over there talking to the engineers, talking with the support team, to their implementation folks, and talking about how they can roll out some of these features more quickly. It's been great to see that. I've also been impressed with some of the case studies that have been presented here. I was sat in one around how they're using Greenway to improve their billing and coding, and how they're actually implementing some really cool incentives to keep their people in-house and keep them motivated, because, hey, these practices, they're struggling like all of their larger brethren on how to keep people in their organizations. I also had the chance to ask a few of the folks who are here, specifically some of Greenway's partners, on what they have thought about the event in 2024. Here's what they had to say.
Hi, my name is Karen Chapman. I'm the Equip Product Manager at Medicomp Systems. We are very happy and excited to be at Greenway ReEngage this year. It's nice to see people face to face and outside of the computer screen. The buzz this week has been all about AI and ambient listening, and it's been great to see all the advances in technology, but also the realization that the blocks of free text need to get back into that structured format. So we're hoping to have some conversations around that and see what we can do to help.
Hello, my name is Ernst Ducasse. I'm with Clearwave Inc. We're based in Atlanta. This has been a fantastic show thus far in terms of having invigorating conversations with current users of Greenway. What we're finding is that, the assumption was that there's not as many Prime Suite users, or the fact that they were looking for some new advancements. And I mean, thus far, a lot of the conversations that we have been steering or having with current Greenway users is around the fact that they like the logic-based scheduling functionality that we do as an organization, as well. I've been very impressed with the kiosk functionality of being able to check a patient in on-site, integrated fully into both of those systems.
My name is Sam Ambrose. I'm Vice President of Strategic Partnerships, Sales and Marketing with Encoda. What we're hearing a lot today, or a lot of the questions that we're getting, are a lot of folks are concerned about getting paid from the payers, and there's a lot of areas of opportunity really when it comes to making sure claims go out correctly or working denials. There's stats out there in the industry that 75% of denials are not worked. So a lot of the practice administrators here are asking questions about, hey, what can we do, or what does Encoda do to help solve that problem?
Hey, it's Ramsey with Vaytiv. Really excited to be at the Greenway ReEngage conference. Been having some awesome conversations about how practice administrators are able to connect with their patients in a more seamless way. Been really cool conversations and trying to come together and figure out how can we deliver these messages in a seamless way that leads to better and faster payment outcomes. So got some great solutions and looking forward to the rest of the week.
My name's Veronica Brand. We're having a great time at the ReEngage conference. It's been a little while. I know the last conference was before COVID, so we're excited to be here and show our support. A lot of work has been going into our Ellkay Orbit platform with helping to connect a lot of different clients across the country with orders and results for our Ellkay Orbit platform. We've had a lot of good conversations. I think the lunch conversation was my favorite. We were able to actually sit down and have casual conversations with some of our clients and some of the Greenway partners as well. So it's been interesting getting to know them, and then colleagues and different partners across the country, physicians and physician practices, and just seeing all of the different use cases and hearing all of the interest that's been sparked. And especially there's a lot of talk around AI, right? So there's so many changes going on right now in the technology space. So it's always great to hear the different perspectives and the interest that everybody's piquing at these conferences. So it's been a really great time and a lot of thought-provoking conversations.
Hey, I want to thank everyone who came on camera with me to share their thoughts on the Greenway ReEngage conference here in Arlington, Texas. It was fantastic to get a chance to interact with all of them. They're all doing some very unique things, and I'll put links to all those companies down in the description. To close, I think I'll just say this. I think it's great that Pratap and David Cohen and the rest of the team here at Greenway are really driving themselves hard to become one of the bigger players in the EHR market. I think it's very bold of Pratap to make all those statements that he did, but I don't think he was wrong to do it or that he was doing it for an ego boost. He really is caring about his clients, and I think he's really going to be motivated to live up to that promise. And I can't wait to maybe come back next year and see how much progress they've made. And hey, if you enjoyed this video as much as I enjoyed making it, please like and subscribe. Also, head on over to healthcareiTtoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.